Hi guys, welcome back to my YouTube video channel again. Today I will show you the result of a case that I have done a couple of years ago. We did the surgical exposure for the impact canine and referred by another dentist, by another orthodontist. So we did the expose and we finished, I will follow up the case and I want to show you how the case turned out. So let's take a look at this case. Okay, so this topic today is a surgical exposure of impact canine and braces before and after. Let's go into directly the case. Let me just show you how the case started with. Um, we use the digital 3D imaging. So, so basically, I just don't want to repeat the video before, but on this YouTube video channel, uh, what would happen if the number 6 were lingually impact. We did the 3D imaging and we were able to locate the enamel surface of the lingual side of tooth number of the buccal side of number 6, and we expose it. We put composite bonding on the gold chain and we pull the tube. I want a fast pace, so you're going to see what's happening. So the trick of this case is that whenever you raise a flap, full thickness flap of the identify location of the canine, and that's where you proceed, take your time and do the flap design to be able to flap and primary closer of this area is important. And so as you can see, you have a primary closer with a golden chain sticking out. And make sure that you don't lose any keratinized tissue. That's where you can get the beautiful result later. That's the key. Don't lose any keratinized tissue of the canine. The most important thing, you guys, is be when the canine is located in the, and also the orthodontist already creating up the room. That is the perfect time to do the gold change. You don't want to do the gold change, expo and bonding unless there's a spade of the canine ready to go. And so I want to show you the result. Okay, I'm going to close this. I'm going to show you the result after several months. So this is the result of several months later. The canine number 6 were exposed lingually. You don't see any damaging. Everything healed up well. And I want you to see the result of the reservation of the canine. It's beautiful, established. The correctional tissue is there. You didn't lose anything. The architecture and the of the gum is beautiful. It's actually look better than this natural way of growing right here. In the long run, I think it's going to be successful. The outcome really nice. Patient is really happy. And so, what do we learn from today? Well, basically, the idea is when you do surgical exposure of canine, you make sure that the gap is ready to go, uh, and primary closure, no correctional tissue loss, stabilize the surgical site. Those are key important part in order to successfully pull the canine out and coordinate with your orthodontist, follow up the case, and that's it. Just want to show you before and after, guys. Thank you for watching this short video. If you like what you see, please continue to subscribe to my channel, and I see you next time. Have a good day. Bye-bye.